Angelman syndrome by Amber Busby. What is Angelman syndrome? Angelman syndrome is defined by a genetic disorder that affects the nervous system. The conditions include intellectual disability, delayed development, severe speech impediment, and problems with movement and balance. This is what Angelman syndrome looks like in a child. They have delayed development, speech impairment, and the balance is unsteady, and their facial features mostly include blonde hair, blue-eyed babies, but they look normal to the eye. Angelman disease usually comes noticeable within the age of 6 to 12 months in newborns. If it is delayed, it comes in the early childhood. Children with Angelman syndrome usually have a pretty normal life when they first get out of the womb. They're happy, excitable, and they smile a lot, they laugh, and they also have a short attention span, and they have a fascination with water. They usually have difficulty sleeping, and they can function with little to no sleep. With age, people with Angelman syndrome become less excitable, and the sleeping problems may improve, but there's no telling that they will. They continue to have intellectual disabilities, and their speech never really gets better, and they do start to have seizures throughout their lifetimes. Adults with Angelman syndrome have facial features that may be described as coarse. Other common features include fair skin, light-colored hair, and side-to-side curvature of the spine, which is scoliosis. The life expectancy is mainly normal for people with Angelman syndrome. This is another look of what a child with Angelman syndrome looks like. Now we're going to look at a case study that I found. It's of a girl named Ever, and she was born on September 28, 2013 at 8:24 a.m. She weighed 6 pounds and 10.5 ounces. At first they thought she was a normal child, and then when they brought her home, she started crying all the time, and they said that she was sometime inconsolable, which means that she never stopped crying and there was nothing that you could do to make her stop crying. It was difficult to change her diapers and feeding, but you could never keep the food down, and she was not sleeping well, but when she was sleeping, you had to actually hold her upright. She seemed very uncomfortable. On October 17, 2013, she was admitted to the hospital with dehydration and fever. The doctors diagnosed her with GERD, a stomach disease, most alike acid reflux. She became happier as a baby after the diagnosis, barely cried, but the sleep never changed. She could function with little to no rest. After her first birthday, they were concerned that she wasn't developing fast enough, and she was not speaking and made no indication that she was trying to speak. And then they also noticed the frantic arm movements that she would do when she was excited. And she was very uncoordinated and off balance. By her second birthday, she was still not able to speak and stand upright. They took her to a physiotherapist and the physiotherapist said that she had sensory processing disorder. So they gave her a vest that she put on to help her with her balance. She soon began to start walking, but she then went to speech therapy, occupational therapy, infant child development, a developmental pediatrician, genetic testing, neurological testing, and massage therapy. On June 17, 2016, they got the results of her genetic test, and it confirmed that she did indeed have Angelman syndrome. Angelman syndrome was first discovered in 1965 by Harry Angelman. That's where it got its name. He reported 3 children of healthy parents with a neurological syndrome of mental retardation, seizures, and facial abnormalities, also speech disorders. He named them Happy Puppet. The name of the syndrome changed to AS in 1987. AS is originated from dysfunction in expression of an obliquin protein ligases 3EA, also known as UBE3A gene in chromosome 15. 75% of the cases happen in this chromosome. Other changes such as translation, mutation, and microdeletion are seen as well. These changes lead to malfunctions of neurons. 1 in every 15,000 births actually have AS. There are 450 cases of AS that have been reported. It occurs in the maternal inherited genes. This is a diagram showing what happens when AS syndrome occurs because of maternal inherited genes. There is no cure for Angelman syndrome that they have found, but they can target specific genes for treatment, and a team of healthcare professionals will likely work with you to manage your child's condition. They can give you anti-seizure medications to control the seizures that your child has. You can go to physical therapy to help with walking and movement problems that your child may develop. They can go to communication therapy to help them talk or actually use sign language and use picture communication, or you can go to behavior therapy to help overcome hyperactivity and a short attention span. If you want to know what the risk is of your child getting Angelman syndrome, it is very rare, and researchers usually don't know what causes the genetic change that results in Angelman syndrome, but most people don't have a family history of the disease. Angelman syndrome may be inherited from a parent. A family history of the disease may increase the baby's risk of developing the Angelman syndrome. Last but not least, I did the MEGA and found that humans and chimpanzees are very similar in this research, and they have the almost exact same syndrome. And then the one that is least like us is the 13-line grounded squirrel. So squirrels are not like us, but chimpanzees are. And then walruses are more like than squirrels than us, which I thought was crazy. But yeah, that's my findings. And I hope you liked my presentation. Have a great day.